Okay, good. All right. Good evening. We're just going to get this webinar rolling. Thank you for attending. My name is Laura. I am the nurse practitioner at the Bariatric and Metabolic Institute here at the campus of Pennington. And I want to introduce Dr. Vance Albaugh. He is our surgeon that is going to talk about surgery and some of the problems involved with the fight with the disease of obesity. And then we'll take some questions at the end. If you have some questions and you want to write them in the chat, that would be fine. If you want to make an appointment or talk to one of us on a telemedicine visit, you'll also have the information from our website. And please contact us anytime during the week. All right, Dr. Albaugh.
Sounds great. Thanks, Laura. Welcome, everybody. I'm going to go ahead and share my screen. Like Laura said, I'm Dr. Vance Albaugh. I'm one of the diabetes and weight loss surgeons at the Pennington and Our Lady of the Lakes Bariatric and Metabolic Institute. And I think, whoa, there we go. Can you see that okay, Laura? Thumbs up. Perfect. Excellent. All right. So this is me. Hopefully we're going to lose the masks here at some point, but for the time being, this is how we're doing stuff in clinic, COVID precautions. This is a serious illness. And people with diabetes and obesity are at the highest risk. And so we essentially see a lot of high risk folks in our clinic. So we take this very seriously. I believe most of our staff, if not all of us, are vaccinated, but like I said, we take this very seriously. We're happy to see you in clinic, but if video visits and other things are more compatible with you, we can also explore that as well. But I'm Vance Albaugh. I'm the diabetes and weight loss surgeon at the Pennington campus. I'm going to talk a little bit about bariatric surgery or weight loss surgery. There are a number of different names that people call it. I usually introduce myself as a diabetes and weight loss surgeon because those are the two diseases that I treat mostly. So the Bariatric and Metabolic Institute is a new entity at Pennington and Our Lady of the Lake. It's a collaborative effort. The clinic is physically on the Pennington Biomedical Research Center campus, which is on Perkins Road in Baton Rouge. Everything for the most part is done at the Pennington site, except for the actual operating, which is done at Our Lady of the Lake, which is just down the street. So we are a comprehensive, I think we're the region's only comprehensive medical and surgical and behavioral weight loss program. We focus a lot on obesity and diabetes treatment and really a multidisciplinary, kind of continuum of care approach. This is where we are. This is an overhead or overshot of the campus. This little arrow is where the entrance to our clinic is currently. We'll be moving in a few months. So stay tuned for that into an area that's got a lot more space and hopefully will be a lot nicer and really be able to really showcase a lot of the strengths that we have on our team. Like I said, our operating, the surgery itself is done at Our Lady of the Lake, which is just down the street. This is some of the founding members of our team. I am not in this picture. This was taken before I was recruited down here last fall. But I'm going to tell you a little bit about our team, but I'm not really going to name everybody because we have a very fast growing team. But I think a very nice resource that I would encourage everybody to go to is on YouTube. We have a YouTube channel. We have a Facebook group. There are a lot of social media presence that we have. If you go to the Bariatric and Metabolic Institute page, there are a number of videos here. You can see here at the top, we've got patients, some of our other providers, Dr. Manalac, who's one of the obesity medicine physicians, some of the surgeons and my other partners here in the second row, and then some other informational videos on this site. So we try to put a lot of this, we know that, the internet is can be a very good thing for education. There could be some scary stuff out there and some misinformation, but if it comes from this site, from our page, you can trust it, you can count on it. And as Laura said, if we're going through here and you have questions or anything, please feel free to put them in the chat. I'm Vance Albaugh, like I said. This is kind of my background. I did my medical training at Penn State, my residency and research training at Vanderbilt. And then I did some time at the Cleveland Clinic and then was recruited down here as part of this big kind of, getting this clinic started here at Pennington and between Pennington and Our Lady of the Lake. But my family and I are down from Cleveland. We're very happy to be out of the snow. We really enjoyed the winter this past year here in Baton Rouge. But really, why are we here today? Why did you log on tonight? Well, you guys logged on, I'm assuming that they're, because you're interested in potentially weight loss treatment, and maybe that involves surgery, maybe that involves medicine. What we do know is that obesity is a disease. It's not treated very well by a lot of people because people don't really consider it a disease. They think it's a choice. They think it has something to do with willpower. We know all of that is really just a bunch of baloney. That's not true at all. Obesity is a bona fide disease. There are numerous diseases that are associated with obesity. You can see some of them here. It decreases the quality of life, and it decreases the quantity of life and shortens your lifespan. And so that's what we focus on. And it also, like I mentioned at the beginning, and this is what, when COVID-19 kills people, it's generally people who have significant obesity or diabetes or insulin resistance. So these are markers for things of an underlying condition that make you more susceptible to COVID and potentially other viruses like this in the future. So this is not a laughing matter, right? This is a serious problem, and we need to do something about that. In fact, Louisiana, as you can see from this map, this is a county by county, parish by parish map of the United States. And when you rank all of the states in the Union, Louisiana is actually number one in extreme obesity. So 6.1% of the individuals in Louisiana have a BMI that's greater than 40, which is not good. When you look at the entire country, and this map doesn't show it very well, but the entire country, 72% of people, so almost 3 out of 4 people in this country are either overweight or obese. And so that is obviously a real problem when, like I said, obesity is associated with 200 other diseases and other numerous health problems that really decrease quality and quantity of life. So obesity and diabetes treatment, this is kind of how we think of things in clinic. And so, as severity of the disease goes up here on the pyramid, the treatment modalities increase in their aggressiveness. And so, lifestyle modification is a very important part of anybody's weight loss journey. Dieting, physical activity, those are all very important parts, but you're not going to be successful in the long term with any significant amount of weight, unless you add something else onto that. So we know that if somebody's got to lose 5, 10, maybe even 20 pounds, in the long run, people can be successful with lifestyle modifications alone, but it's really hard to you're fighting, Mother Nature, you're fighting your biology. And so if you need to lose more than that, more than 20, 25 pounds, you've got to kind of step it up here. And so we have some pharmacotherapy, some drugs, some weight loss medications that are an option that some of our obesity medical providers can kind of walk you through and prescribe. And a lot of people will try one medicine or another and kind of see if it's for them, see how they respond. Some people respond very well to this, to some of these medications, and some people do not respond very well, and they don't like the side effects, et cetera. But for the folks who are coming in who have the severest form of the disease, surgery is really going to be the treatment that leads to the most definitive, most significant, long-term weight loss. And so generally speaking, once you get above a BMI of about 40, that means you are about 100 pounds overweight. That's a reasonable estimate based on those numbers. If you're 100 pounds overweight, or you have a BMI of 35 and you've got one or more of those associated diseases, so high blood pressure, diabetes, PCOS, reflux, that qualifies you from an insurance perspective in most cases for bariatric or weight loss surgery. And so that's what, as I mentioned, that's what we're going to talk about in this kind of brief webinar. And so this is what bariatric surgery looks like in 2021. The most popular operations are over here on the screen left, the sleeve gastrectomy, where we take a portion of the stomach and we remove that. The gastric bypass is the second procedure here, where we create a small stomach pouch and just reroute some of the plumbing, so the intestines. Gastric banding used to be, the third one over here, gastric banding, used to be very popular, but we really know that in the long term, this is not very effective, and there are some risks associated with it. And really, when you think about the benefit that you're going to get and the risks, even though the risks are small, the benefit is not very good in the long term. So a lot of folks, including myself, have stopped doing this, and I don't really offer this to my patients because I think we have much better options in terms of surgery. The last operation here on the far right is the duodenal switch. This is, as you can kind of look at the pictures here, this is kind of a combination of the sleeve operation with some of that rerouting of the intestine. So it's kind of a combination of the first two. This is something that I generally reserve this for my patients who have a BMI 60 or 70 potentially, A lot of times this is done in a 2-stage procedure where somebody will come in for the sleeve portion, and then they will come in, 6 to 12 months later after they've lost 100, 150, 200 pounds for the second stage of the procedure. Let's talk a little bit about some of the specifics. So when you are looking at individuals in this country and really in the entire world who have bariatric or metabolic surgery, about 95% of people having a procedure are having one of these two, the vertical sleeve gastrectomy and the Roux-en-Y gastric bypass. Like I said, the switch is really reserved by most people for individuals with very significant disease, really have several hundred pounds to lose. This isn't somebody who's coming in with a BMI of 40 or 50 even. Those individuals, even up to 60, 65, those individuals can be served very well by either one of these operations here on the left. One of the big things that's changed over the last 20 to 30 years is we used to do these procedures through, an incision on your belly that may have been 12, 15, 16 centimeters long. This, caused you to stay in the hospital a couple of days. Recovery was pretty significant. You had some pain. Now we do all of these operations through laparoscopic incision. So generally speaking, when I operate, my patients get their operation through about 6 small incisions. These are all about 5 millimeters, and one of them is about 10 millimeters. Come in one day, they go home the next. In some places, they do this as an outpatient operation. I think for safety reasons, we keep everybody overnight, and I think that's the right thing to do personally. But this is what it looks like in real people. So here's about 4 to 6 weeks after an open gastric bypass, huge incision, huge scar, same amount of time in a different patient. I mean, you can, in 6 to 12 months, you won't even be able to see the incisions on this lady. And so, this is really the advent of laparoscopic surgery, and the ability to do these huge operations, complex operations through small incisions has really changed the face of this specialty, and really allows us to help a lot of people who I don't think we would have been able to help before. With the sleeve gastrectomy, we reduce the size of your stomach to about the size of a banana. So we remove this portion of the stomach that would have been kind of right next to the stomach remnant here, the sleeve. But this leads to about 50 to 55% average excess weight loss. There's no rearranging of any of the intestines below that. This is the most common operation in the world. I see a lot of patients who come into clinic and say, I know somebody had the sleeve. I want the sleeve. I'm not interested in anything else. I'll say in terms of technical ease, this is an easier operation to do. Although it still has its risks. It's still general anesthesia. It still has a risk of bleeding, et cetera. I think patients feel like this is a lot more kind of friendly looking, and I get that. And that's why I think this is, become one of the most popular operations in the world. In second place, and this procedure used to be the most popular operation in the world. This was the Roux-en-Y gastric bypass. The differences about this procedure are we don't remove anything in this operation. So the whole stomach stays intact, and this empties kind of through this, the intestines here. Laura, can you see my cursor when I do this? Oh, you can. Okay, good. So the stomach empties this way. But then when food comes down the esophagus, you've got a small stomach pouch here, and then it immediately goes into the intestines and bypasses a significant amount of stomach and intestines. This does cause a bit better weight loss. So, the sleeve was 50 to 55% of average excess weight loss. This is about 70 to 75%. It's potentially a reversible procedure, but it's very rare that we would ever do that. But this, again, is a very effective operation, especially for individuals who have reflux. It can cure the reflux at the time of the operation. And for diabetes and some other metabolic diseases, this is a much better operation. These are all things that, when you see me in clinic, these are things that we have a very frank discussion about, and I can give you my opinion. I always tell folks that when they come in and they're interested in one operation versus the other, many times we're able to do that operation. There are a few things that would lead you one way or the other, but both of those are very, very good, kind of bona fide metabolic operations, and people have very good results long-term. The benefits really, aside from the weight loss, there's a huge improvement in the quality of life. So 95% of folks say they're living a better life. There's a 30 to 40% reduction in the chance that you die in the next 5 years. This is a huge increases compared to other therapies that we have. Improves liver disease, improves diabetes in women who have PCOS and even have problems with fertility. It can actually resolve that. So I've had patients in the past who who they come in, it's very typical. They come in, they say, you know, my husband and I, or, you know, my partner and I, we have one child. We haven't been able to have a second child, and we've tried everything and it's just not in the cards for us. And then, you know, 6 months after surgery, you know, they're pregnant. And so, you know, getting your metabolic disease under control really helps with a lot of things. It's not just the weight loss. It's not just the number on the scale. Reflux, high blood pressure, asthma, all these things improve. So there's a huge number of a plethora of benefits of surgery. There are complications. I typically quote my patients, and I say possibility of any complication. I generally say it's about 5 people out of 100 for a gastric bypass, and about 2.5 people out of 100 for a sleeve. Now, bariatric surgery is very, very safe. It's just as safe as having a C-section. It's just as safe as having your gallbladder out. It did not used to be that way 20 to 30 years ago. You know, you were in the ICU. It was all done through the large incisions. That is not how we do things today. It's very different. Because surgery is so safe, we have to add up all of these things here on the left side of the screen. We have to add up all of those to get any kind of meaningful number that we can talk about in clinic. And so this 5% of people who have a problem or a complication after gastric bypass, I tell my patients that's typically nausea. Maybe you have to stay an extra day or 2 in the hospital. Things that in the long term are not a big deal. They're more frustrating and acutely, but in the long term, they're not a big deal. The things I worry about as a surgeon are things like blood clots and pneumonias and things like that. And those are almost unheard of after bariatric surgery with the precautions that we take. But again, it is surgery. You're going under general anesthesia. You know, it's safer to take a medication, but you're going to take medication for the rest of your life. Whereas surgery, you have surgery one time and that's going to be your lifelong treatment. Pre and post-operative care are extremely important. All patients that see me and the other providers in clinic, they see the dietitians, they see the psychiatrists and the psychologists. We focus on healthier eating, healthier activity patterns, and incorporating exercise into your life. All of my partners and the other folks in clinic, we really take an individualized approach to this because everybody's journey is different. Everybody's coming to us with a slightly different story, with slightly different goals. And so I think the strength and what I really like about our clinic is that we really individualize the approach and really work with you one-on-one to kind of get you to where you want to be. There are many components of the road to success. We offer all of those at the Pennington location. Like I said, we are the region's only comprehensive medical and surgical weight loss clinic. And I think it's, in terms of quality and in terms of what we offer, I don't think there's any other place in Louisiana, really, or in the region that can offer what we can offer. So, excuse me. So final points, I'll just say, metabolic and bariatric surgery, it is the most effective weight loss therapy. It's going to be more effective than diet, exercise, and medications. But again, you have surgery, and ideally you have surgery one time and you reap the benefits. For patients with diabetes, surgery is really the best chance at ever achieving a remission or a cure of their diabetes. So we do have patients that come in, they're on insulin, a couple of the diabetes medications. I generally tell my folks that, having the bypass and having surgery is really important because without significant weight loss, there's no chance for cure of diabetes. And with the bypass, that's definitely a possibility. Not for everybody, but for a lot of people. There are many strategies. Like I said, we kind of offer all of them. And wherever you are in your weight loss journey, we will meet you there and walk with you and kind of be with you and try to figure out, what is it that you want? How can we best help you? And probably one of the most important things, though, surgery is just a tool to help you achieve that maximum potential for your weight loss. Surgery without exercising, surgery without watching your diet, it is not as effective. I've had folks that have the sleeve gastrectomy and they lose 20 pounds. I've had folks that have the sleeve gastrectomy and they've lost 220 pounds. So, it's really what you make of it. And for whatever reason, I always tell my patients in clinic, we do not understand how these operations work. Even though the bypass has been around since the 1960s, it's really a black box. And we know that they are the most effective treatment. We are still working and with the help of folks at Pennington, researchers and other individuals, we're trying to understand how those things work so that, hopefully one day we don't have to operate on anybody. We can target these things without surgery. But for the time being, surgery is really the gold standard in terms of weight loss. And it's not the easy way out. And you'll see this on websites. Surgery is not the easy way out. It's the most effective treatment, but it is by no means an easy way out. There's a lot of dietary and lifestyle changes that you will have to make to ensure your success. I'll end with this. You hear a lot of things as a weight loss surgeon, and here's just a couple of the comments that my patients have told me over the years. I mean, I can't say that I've ever heard anybody say, that this was the right time for the surgery, or that, oh, we could have done this 5 years, later. Everybody uniformly, for the most, says, I should have done this 10 years ago. I should have done this 20 years ago. Why didn't I do this earlier? That's a very common thing that people say. I had one patient, her husband would fold the laundry, and now he would mistakenly put her jeans with her teenage son's clothes, which was a real win for her, kind of non-surgical weight loss or non-weight loss goal. People say, I haven't been this weight since high school. I don't remember the last time I felt this good. People don't recognize me anymore. It's great when people come into clinic, they have their new license photo and their old license photo, and they say, this doesn't even look like the same person. And they're right. They're totally different. So there are a number of other free support groups that you can get some information on our website. But we'll, with that, I'll open it up to questions, and we can go from there.
Great. So I have some questions, Dr. Albaugh.
Yes.
One is, how long does it take to get to surgery?
That's a great question. So that is let me try to unshare my screen here. That is an excellent question. So I will tell you, it's different every place, and it's different depending on what your insurance plan is. And it's different kind of depending on the workup that you as the patient might require. So somebody coming in who's relatively healthy, they're young, they're low risk for heart attacks and things like that, things that we worry about, when people are 60 and 70 years old, that we wouldn't worry about when someone's 25. Those patients, I think, currently in our clinic, it's probably, I would say, to get from the first appointment to surgery, I'd say at least 6 to 9 months on the average. Sometimes it's sooner, sometimes it's longer, but I think that's a reasonable ballpark. But it depends on a lot of things, and it's not, like I said, every journey is individualized, and so it's hard to give one blanket number for everybody. But that's a good question.
Great. Okay, here's another question. Will I have to take vitamins for the rest of my life?
Excellent question. So I get this a lot. If you look at some of the older studies, especially from the open gastric bypass era, those patients definitely needed to take vitamins. Our standard kind of what we will tell you is, yes, we recommend that you take vitamins probably for the rest of your life. I will tell you though, patients get a year or two out, they feel good, and they will self-take themselves off of their vitamins. If, there are probably some people who, if they can get enough of the vitamins with their dietary intake, but you will never hear any of us say, you don't need to take vitamins. I would say if you're thinking about surgery, I think the safest thing is to know that in the long term, you're going to be on a bariatric vitamin. I would not advise coming off of them. If you get several years out and you want to try something like that with your primary care doctor or with one of us in clinic, that may be something that we can talk about in the future, but I would not, there are some significant vitamin deficiencies that you can develop after bariatric surgery. Some people develop them very easily. Some people never develop them, but you don't really know who you are, and you don't want to find out the hard way. So I think if you're thinking about surgery, I would plan for daily bariatric vitamins, essentially forever.
Yes, and that's one of the things I'd like to add is that part of your follow-up is to have vitamin levels drawn. We follow your lab work. We see you about every 3 months in the first year, and really we'd like to see you once or twice a year forever. And we'll work with your primary care. It's important that you do certain lab work to make sure that things are remaining in that healthy zone. You don't always feel a vitamin deficiency as it's happening, but it would really be important, especially for our ladies of childbearing age. And it's important that you follow up with us forever. And that's why we have such a comprehensive team. So there's a lot of medical things to follow up with. There's a lot of nutritional things to follow up with. But the most important thing is those things are improving. And we love the follow-up visits because we celebrate those improvements as you go through them. And there's a lot of scale related victories and a lot of victories that don't have to do with the number on the scale, like wearing smaller jeans. One of the best quotes I just heard from a patient, she's fairly recently had her surgery, but she just bought a Corvette. And she said the best feeling was getting in that Corvette and her stomach doesn't touch the steering wheel anymore. So that was a new one for my list. I like to collect those non-scale victories. Are there any other questions? I'm not seeing any other questions, but in closing, what I'd like to do is encourage people to call our office. If you don't know if you have insurance coverage, we have a team of experts that are very good at negotiating that pathway and making sure that we get insurance coverage discussed and walk you through those steps, because every insurance policy is different. And we don't want you to get your hopes up and then find out your insurance requires something differently. So we have the best, most experienced team of navigators. So that's where you kind of enter our world, and hopefully you never leave it, and we walk this journey together. So if that's the end of the questions, I'd like to just say good night and thank you for attending, and I'm looking forward to hearing from you. Thanks, Dr. Albaugh.
Great. Thank you, Laura. You guys have a great night.
Bye-bye. Thanks, Andrew.